Hello viewers, today I want to introduce to you a book I have written in support of my primary or preventive healthcare effort in the communities. The book title reads, The Role of Public Medical Knowledge in Disease Prevention and Treatment. This is the book. The Role of Public Medical Knowledge in Disease Prevention and Treatment. Before I move on with my book promotion, I would like to say this. It is the duty of the doctor or the nurse to explain to patients and relatives the kind of disease that they come to the hospital with. That is one of the duties of nurses and doctors. Unfortunately, that has not always been the case. I think a number of factors contribute to this. One is that the healthcare professional, the nurse or the doctor, will say he or she doesn't have enough time to explain to patients and relatives the kind of sickness that they come to the hospital with. The second factor in my view is that many patients and relatives come to hospital and they seem not to care to ask questions or know exactly what is wrong with them. The third one in my view is that many patients and relatives feel intimidated when they visit the hospital. For that matter, they just can't open up to ask questions bothering them. They can't ask the doctor questions, they can't ask the nurse questions, so they just withdraw and then look on for them to be taken care of. Is it true healthcare professionals don't really have time to explain to patients and relatives the kind of disease that they visit the hospital with? Well, to an extent, it is true. You see, medical knowledge in itself is very complex. That is why doctors have to school for as much as 7 years. Explaining such complex and technical medical knowledge or topic to someone who is not a healthcare professional can be very difficult and time consuming. I think that could be one of the reasons why a doctor or a nurse may simply ignore explaining to patients and relatives the sickness they came to the hospital with. One particular medical knowledge or topic requires speaking from different medical fields for the ordinary person or for someone to understand, and doing so can involve much time. And we know in the public sector, for instance, we have a lot of clients, we have a lot of patients who are anxious to be taken care of, to go home. So I don't think the doctors or the nurses will have that time to use about 30-40 minutes explaining to all these people the particular kind of sickness or disease that they have brought to the hospital. So in my view, this actually contributes to the problem of patients going to hospital and not knowing exactly what is wrong with them. The house. When the patient is discharged, who takes care of the patient in the house properly? We all know the doctors and the nurses don't really visit home continuously to offer the management of such cases in the house. We know this. It means that you, the patient or the relatives, have to assume that role to properly manage some of these conditions in the house so as not to develop complications. So a lot of people are living with chronic diseases that you can't completely take away from the body system, but you have to manage it. A lot of people are living with these diseases and they just don't know anything about it. They just don't know how to manage it. They just don't know any preventive measures or preventive management that will prevent the disease from advancing to the next stage. Unfortunately, when you go to our hospital, many of the patients on admission are there as a result of complications of diseases. I have explained what complication is, so you may visit my page to learn more about it. So a lot of people are suffering on hospital bed because they just couldn't manage a particular disease in the house properly, and then the disease now advanced to a more complex or a different disease developed as a result of the initial disease which was not properly attended to or managed. That is complication of disease. So you see, this is the reason why we, the public, we don't have to assume medical knowledge is for healthcare professionals. We need the medical knowledge badly as non-health professionals, because the sickness affects you. We spend most of our time in the house when we are sick. When you go to the hospital, you are meant to be treated, and then you go home. You spend most of your time in the house. So having basic knowledge on health, having basic knowledge or understanding on what is wrong with you, how to manage it, you the individual, you need it, and it's going to help you a lot. So in conclusion, I urge each and every one of us, when you go to the hospital, be anxious to know what is wrong with you. When you send your father to the hospital, be anxious to know exactly what is wrong with your father. Ask questions. If you ask someone and the person really is not giving you the attention or the answer, you can go ahead and ask someone else. The last point I raised, patients and relatives feeling intimidated when they visit the hospital. I want to tell you that it is your right to know exactly what is wrong with you when you visit the hospital. As a patient or relative, it is your right to know the kind of treatments you are being offered in the hospital. So don't feel intimidated when you go to the hospital to ask questions. Feel free and ask the questions. You might meet a doctor or a nurse who is not all that friendly, but he or she knows that it is your right to know exactly what is wrong with you. He or she knows it is your right for you to know exactly the kind of treatments you are receiving. We, the health workers, we know. The unfortunate side is that a lot of people do not know that it is their right. So when they go to the hospital, they are just scared to ask questions. So no doctor or nurse will visibly get angry with you because you are seeking to know what is wrong with your relatives. You are seeking to know what is wrong with you. No doctor or nurse will visibly get angry with you because they know it is your right. But when you are doing that, you should also be polite. You should also do it in a manner that he or she will not be offended because of the pressure of taking care of a lot of people in the hospital. I would like to reiterate that it is good. It is a very good thing that you, the non-health professional, you, the public, arm yourself with basic medical knowledge. If you have diabetes and you can manage it properly, you don't have to worry about going blind. If you have diabetes and you can properly manage it, you don't have to worry about getting your leg amputated as a result of infected wound which will never heal or which is very difficult to heal. If you have diabetes and you properly manage it, you don't have to worry about getting chronic kidney disease, because these are some of the complications of a disease like diabetes, and a lot of people are suffering because they just didn't take care of themselves when they had this disease initially. People who have basic knowledge on some of these things, when you see them, everything shows. I have seen a lot of people living with diabetes for 30-40 years without complication. If they don't tell you, you wouldn't know. I have seen a lot of people living with hypertension for 30-40 years If they don't tell you, you wouldn't know. Why? Because they have basic knowledge on the disease and they spent their time to properly manage it at home without going to the hospital because a complication set in. Ladies and gentlemen, I urge each and every one of you to get a copy of this book at home and read The Role of Public Medical Knowledge in Disease Prevention and Treatment. This is a book written specifically for non-health professionals. It is not a book for students in the medical field. It contains more than 30 common disease conditions that people come to the hospital with. We have diabetes, hypertension, chronic kidney disease, chronic liver disease. We have ulcer, prostate cancer, breast cancer, malaria, HIV/AIDS, hepatitis, a number of them, more than 30 common disease conditions that people bring to the hospital. It is very easy to understand. You, a non-health professional, may pick a medical book, a typical medical book. You may read, but you can never understand anything in the book because it's a book of medical jargons and terms that the medical professional already knows. But this book is designed in a way that anybody at all can read and then understand. Your child in GSS upper primary can read this book and not have problem understanding it. So get a copy in the house. I can tell you for a fact that doctors and nurses do buy this book, probably for loved ones. If you care about the health of your loved one, please, I want you to buy a copy of this book and give to him or her. It will help a lot. The book has been reviewed and endorsed in by a number of medical doctors. You can get copies of the book wherever you are. All you need to do is to call us on this number 0555 146745 0555 146745. Just call us and then we will make sure you get your copies anywhere you are in the country or even beyond. Thank you.